You recorded.
Got it. Okay, let's restart. Today we'll have two lectures. Professor Yin will introduce the modern tongue diagnosis, like give us some brief instruction, and for about 1 hour. And after that, I will introduce the application of modern tongue diagnostics in gynecologic disease. Will be another hour. All of our lectures have copyright, so recording is not allowed. Just to let everyone know about this. And first, I'll introduce Professor Yin first. Professor Yin graduated from Shandong University of Traditional Chinese Medicine in 1988. Before coming to UK to practice Chinese medicine, he worked in Qingdao Hospital of TCM. Currently, Professor Yin serves as a distinguished clinical expert of TCM at Beijing University of Chinese Medicine. He's the president of the International Association of Modern Tongue Diagnostics. And also, he's the advisor and vice chairman of the academic committee of Federal of TCM practitioners in UK. Professor Yin is also the dean of the International College of Modern Tongue Diagnosis. He's also the member of the Pulse Committee and the Habilitation Committee of the World Federal Traditional Chinese Medicine Council. Professor Yin works as the editorial board member and chief editor of the Journal of Chinese Medicine in the UK. And at the moment, he practices in Streatham Chinese Clinic in London. He's a very famous expert in tongue reading and related treatment, like mainly TCM treatment. Professor Yin established the modern tongue diagnosis system. He also established the modern tongue diagnosis training courses. At the moment, we are going through the number 16 training courses now. He also published monographs, English editor called Modern Tongue Diagnostics in Chinese Medicine. You can search from Amazon. And also there's Chinese books called Principles and Maps of Yin's Modern Tongue Diagnostics, Yin's Tongue Diagnostics Based Herbal Methodology. So these two Chinese books, possibly you can get it in China now. Okay, let's welcome Professor Yin.
Okay, thank you, Dr. Sun, for the introduction. Let's see, so I want to come in. 这个我就不管这个进来的啊，我就开始了。
Okay, I'll concentrate.
We'll start the lecture. Yeah. Okay, good afternoon, everyone. Today I will give the lecture is for brief introduction of modern tongue diagnostics. First, we talk about what is modern tongue diagnostics, and then we use a short letter called MTD, okay, to instead of the third word. Modern tongue diagnostics is a new discipline that integrates diagnosis and treatment based on traditional tongue diagnosis from Chinese medicine, combined with holographic biologic theory and conventional medicine. Also has absorbed the experience of modern doctors, and most of the key knowledge is from my own discovery. This is what is Yin's MTD. Let's give a short review of the history of tongue diagnosis. In around 2,700 years ago, about the Yellow Emperor Internal Classic, they spoke at that time. The tongue diagnosis is not the main diagnosis method for Chinese medicine. In that time, the main diagnosis method is the pulse reading, pulse taking. And in this book has recorded a few of the symptoms from the tongue, like curly tongue, or dry tongue, or stiff tongue, or yellow tongue, etc. When the time goes to Han Dynasty, about the Shang-Han Sabinglun, that time, the master Zhang Zhongjing has used the tongue as a diagnosis method, but also it is not the main diagnosis method in the Han Dynasty. In his book, he has a right view of the paragraph related with the tongue diagnosis, like Yang syndrome with the tongue coated, so use xiao chengqi tang. Or another paragraph writes, Zangjie with white and slippery coating, so difficult to treat. So that means Master Zhang has used tongue as a diagnosis method, but just is for support, not the main diagnosis method. In his book, the main diagnosis method still is pulse reading. And for the times fly goes to the Yuan Dynasty, the important book has appeared. It's called Ao Shi Shanghan Jinjing Lu. This is the first tongue diagnosis book in Chinese medicine history. And in this book has recorded about 40 tongue signs, and each sign has analysis is pathology and the treatment principle and the prescription. To the Qing Dynasty, tongue diagnosis has got a great develop. So there has many tongue diagnosis book appeared. Like this one called She Jian Bianzheng. This one is it's extended the diagnosis, tongue diagnosis from the exogenous disease to internal disease. And when the time to Republic of China time, about in 1920s, another important book about tongue diagnosis has been written. And in this book, has incorporate modern medical anatomy and physiology, and also has accumulated all the tongue diagnoses before the Republic of China time. And when the time goes to People's Republic time now, and tongue diagnosis also get a great development. So until now, new tongue diagnosis appeared. We call the modern tongue diagnostics. So this is a complete diagnosis and treatment system, incorporate a bioholographic theory, and of course has many my own discovery of this. The tongue diagnosis is so important because the tongue diagnosis is the root of all physical phenomena belongs to the tongue. Tongue is the mirror of our body health. The most typical diagnosis of concrete manifestation in the four diagnoses is the tongue diagnosis. And everyone, if you have a digital camera or have the digital iPhone, so you can be easy to take a tongue picture, and this make you have a solid evidence to give the diagnosis. And also during this current epidemic of COVID-19, tongue diagnosis is a unique diagnostic method of Chinese medicine, was widely used by frontline doctors of Chinese medicine as the main basis of diagnosis and treatment. Because we can't directly to touch the patients. So we can, through a distance, to have a tongue picture, and we analyze the tongue picture, then we know what happened with the patients. Of course, tongue diagnosis has unique advantage in telemedicine. We can treat far distance patients without to see the patients. Yeah, this is the unique advantage. Is much advanced than pulse checking. The pulse check, you have to see the patients face to face, but the tongue diagnosis you don't have to. Modern tongue diagnostics committed to visualization of TCM theory as like a tongue hologram of modern tongue diagnostics, the tongue midline theory, and the 10 principles syndrome differentiation, and 3-jaw and 6-jaw division in tongue, and 8 extra channels and 9 palates division in tongue. Also include only tongue no syndrome, no symptoms syndrome. This means treat with herbals and acupuncture points based on tongue diagnosis, not we treat the patient just based on what the patient told you. So we treat is based on what we have seen. The MTD advantage include the visualization of traditional Chinese medicine theory, and the modern tongue diagnosis is more accurate for disease diagnosis and syndrome differentiation. For this, I will give more example, more case study to explain it. And also the preciseness in choosing herbals and prescriptions. And of course, the result is reliable. There is several characteristics of Yin's modern tongue diagnostics, including we have the unique holographic corresponding system, unique tongue biohologram, the discovery of the head and neck gland reflex zone on the tongue. Also, we have a comprehensive tongue herbal medicine and tongue acupuncture corresponding system. Also, we have the unique tongue midline theory, and another one is differentiation with 10 principles, not 8 principle differentiation. The main content of Chinese, the MTD is the disease diagnosis and syndrome differentiation by the tongue reading. And also we give the treatment by tongue, only tongue, no symptoms. It's including tongue herbal corresponding system, tongue acupuncture corresponding system, and tongue herbal formula corresponding system. This is just tell the history of tongue hologram from the oracle word in Chinese, and the tongue just show like this work. And this is in Qing Dynasty, a book called 舌尖辩证 to show a tongue hologram. This is in 2008, a published book by Dr. Guo in China. And in his book, he has published his own tongue hologram. But in this picture, you can see he put the tongue, he put the heart on the tips of the tongue. So this is has a lot of argument. So I have seen this, so I suspect and his picture, he made this hologram something wrong. So to resolve this question, I made a lot of effort and finally made my own modern tongue diagnostics hologram as this picture. Yeah. This picture, we can see this is innovation part of MTD. Let me explain this picture. It is like a baby with the head raised and looking forward. Can you see? It's looking forward, not with the front prone position of the head. The head is on the tip of the tongue. The shoulders and the hand are on the edge of both sides of the tip. It should be here. Okay, if you see this side, this picture, you can see the hand. Yeah. The forelimbs are flexed on both sides of the tongue. That means the knee and the elbow are next to each other. The elbows and the knees are adjacent. The hips and feet are on both sides of the back of the tongue. and the whole body is in a prone position. This is important. Is in prone position. The tummy lie on the surface of the tongue, not the back lie on the surface of the back. This is important. Yeah, don't mix it wrong. Any tongue, when you see in your brain, you should show the picture like this, not show a belly on the top. From the tip down to the back of the tongue are the lungs, heart, stomach, liver, kidney. This picture show traditional Chinese medicine tongue heart position and the holographic heart position. Because as I just said, Dr. Guo's hologram is just made the heart on the tips of the tongue. If you talk this in traditional Chinese medicine way, this is right. This is correct. But when you talk in hologram in that way, so this is be wrong. Should be in this part. Should be located. The heart should be located in the border between the upper jaw and the middle jaw, and when we see this line, the tongue midline, just round this part. To achieve this, I also made a lot of effort. Yeah, because this tongue picture lets me make the tongue holographic heart position. Few years, around at least 10 years or even more than maybe 15 years ago. I can't remember exactly the time. German doctor has sent to me this picture, this tongue picture, and asked me, Dr. Yin, can you tell me the patients what's the problem she got and how to treat it? When I read this tongue picture, I have we see the tongue midline is deviate to the right side, made the left side tongue much bigger. And also we see this side is much smaller than this side. So I said the patients should have a breast problem, probably is breast cancer. The patients has maybe have heart problem. I cannot exactly sure, because at that time the tongue, my tongue holographic picture has not made. I just look for the answer, but until this picture appear, I haven't got the answer. So when I gave the answer to this German doctor, so he just told me, yes, their patient has breast cancer already removed by operation. Her heart has a transplant. So through this picture, I determined the heart position should be in, between the upper jaw and the middle jaw and the middle line, at the middle line. So in this place, not in the tips. And since then, I have tested so many heart disease patients, and every of the tongue for heart disease has confirmed my judgment. So that's why I made my own tongue hologram. Also, I continue to make to discover the secret on the tongue, like the challenging conventional notions. I have made a groundbreaking discovery concerning the reflection of glands in the head and neck of the tongue. Specifically, those glands are distributed on both sides of the upper jaw area of the tongue. Notably, the corresponding regions reflecting the thyroid gland are situated on the two-side edge of the upper jaw area, near the demarcation line between the upper and middle jaw. Okay, this is the upper and middle jaw, this demarcation line. And just after that is the thyroid gland. This is the parotid gland, and this is the tonsil, and this is the pituitary gland, and this is the brain. When you see any change in this area, so you'll be suspect the patient has a thyroid problem, like any dark color or a red color, red dot, or any like scallop shaped here. So all you can all you need to suspect the patients get a thyroid problem. Maybe it's a new problem. Maybe it's recorded the history of the thyroid problem. And this significant finding present are convenient and effective method for diagnosing thyroid disorders. And later I will give a case study for this. Let's talk about the important theory we call MTD midline theory, tongue midline theory. MTD tongue midline theory. What is the midline of the tongue? The midline of the tongue is the line from the tip to the back of the tongue, which separates the tongue lengthways into the left half and the right half. Often we determine the midline using the natural groove on the upper surface of the tongue. A normal tongue midline is a straight line down the middle of the tongue. It should not curve or bulge in any direction at any point. If the midline deviates to the left or the right, or curves sideways, or arches up, or curves in any point, or breaking in any point, then it indicates pathology. Because the midline theory, so we can easily to analysis of the tongue show the qi movement. Like in this picture, we call the qi ascending, descending diagram. If you draw this, this is a midline. Yeah. If the midline deviates to the left side, like the deviate to here, so show the tongue left side is much smaller than the right side, then we can define this is a liver qi shortage and or liver qi deficiency, and the lung qi get blockage because the liver qi supposed to ascending, but smaller show they are not enough. This side bigger show it because the left side, the right side, in terms of Chinese medicine, represent the lung. So we see a lung qi blockage. Then we can analysis the patients should get lung symptoms or large intestine symptoms because lung and large intestine, they are exterior and interior related pair. By dividing the midline of the tongue, the traditional theory of left ascending, right descending, and left liver, right lung are visually presented on the tongue, leading to the formulation of 7 principles of midline. These 7 principles of midline has already published in the book, in this book. If you are interested, you can buy the book through Amazon, and you can read them. Not only this, a lot of the things in this book. Yeah. And this approach advocates for the 10 principles syndrome differentiation and the guidance of MTD, which adds the principles of qi descending and qi ascending to the traditional 8 principles syndrome differentiation. In MTD, we use 10 principles syndrome differentiation instead of 8 because it added the 2 qi ascending and descending. So this made our differentiation more accurate. I'll give you follow this picture just show. Let's use the front one. Show 3 pair of the qi movement. This, the green and the white one showed is the liver and the lung qi movement. The liver qi mainly for ascending, the lung qi mainly for descending. This in the middle jaw, there are 1 pair. Show is the middle jaw, spleen, and the stomach, mainly for the digestive system. And the yellow arrow showed is the spleen qi ascending, and the blue arrow showed is the stomach qi descending. And this is the key qi descending and ascending part in our body. And the black line, the black arrow and the red arrow show another pair of the qi movement is the water and the fire. Also, you can see is the kidney and the heart. If the patient's body, the upper jaw part show like red, this part, and the lower part show is white, That means the upper part is get fired, flame up, and the lower part is the young diffusion, upper part is the heated up, So that means the water and the fire will get separate. So the patient will get a problem. Or is the problem already starting? This show the differentiation with the 10 principles. We know the 8 differentiation with the 8 principles for the syndrome differentiation is yin-yang, exterior and interior, heat and cold, difference and excess. And I added 2 pair is the ascending and descending. This is we can see a develop of the Chinese medicine theory. Here is to tell us how to define the 8 extra channels. In here, just show 2 is the conception meridian and the Gowner meridian. In here, you can see crack in the at the midline, on the midline. So it shows is the Gowner meridian or the Du meridian has a problem. So when we treat it, we suppose to tonic the Du channel or Gowner meridian energies. This tongue show is a conception meridian, or you can see a Yin meridian, Yin channel has a deficiency problem. It shows this the midline get concave and it's a deficiency problem. So we need also use a tonic method for this. Also, it shows if this happened for the tongue, so you will give a judgment that patients should have a lower abdomen problem. Maybe some tumor has already formed. This is how to observe back of the tongue. So normally we will see look the qi and blood status and the blood contents. Yeah, if you get the small small vessel get enlarged red, so you need to think the patient's blood contents get changed, like too much sugar, too much uric acid, or too much like fatty, have too much fat. Now we talk about some case. Okay. This is COVID-19 patients when the COVID just started. This is I think it's 2020. The patients has sent the tongue picture to me and write dry mouth, dry cough with chilly and fever, also has diarrhea for 5 days. And that patient says itself is also is a doctor, is a conventional medicine doctor, and he has been diagnosed as coronavirus infected pneumonia. So I give this prescription and based on the tongue reading, and you can see the both side bulging. And then the middle also is bulging with yellow-white or yellow-greasy fur. So I applied Xiao Chai Hu Tang and Ping Wei San for these patients. This is the mainly used herbs. You can read it. After 5 days, the patients, the fever has stopped, diarrhea stopped, and left. There are no sweating or no cough. So these patients get a quicker recovery. Let's see another case. Case 2 is a damp and febrile disease. Because this is happened in August, in China, August. So it's like late summer or beginning of autumn, that kind of season. The weather still is very hot, but with damp. And the patients get a fever, cough, and goes to a big hospital, get a treatment with antibiotics for 10 days, but the fever not stopped. And the doctor who in charge treat her, so suspect the lady get a lung tumor. So want to get a biopsy from her lung. So her daughter is my friend and send a message through WeChat, ask me whether her mom can get the biopsy for the lung. I said, just send a tongue picture to me. And then she sent the tongue picture. I read picture. I has analysis of this picture. Let's see. Through the tongue midline, we can easily define that the left half is smaller than the right half. So we know this is a lung problem with because this side is much, the right side is bigger. We know it's lung blockage, and this small piece of the tongue fur has lost, and we know this side of the lung get much inflamed, more than the left side. Other part covered by the yellow greasy tongue fur, so we know this is heat and dampness. So I said, okay, take 5 bag herbal tea, and then tell me what happened. So this is the prescription I made for this lady is Yin Chen, Hua Shi, Tong Cao, Shi Changpu, Huang Lian, Huang Qin, Hope, Xing Er, Sha Er, Yi Er. And those, we see this prescription like the herbal Yin Chen, Hua Shi, Tong Cao, Huang Lian, Huang Qin, Yi Er, they are all is cooling and also good to eliminate the heat and dampness. The Xing Er is mainly for the right side tongue qi descending, because right side tongue has the lung qi has get a blockage and not descending easily. So that's why I did these herbs. After 5 days, the patient was able to discharged from the hospital, and the fever stopped, and she feeling generally okay. But still get a loose stool, relatively dark color. So I just modified her prescription, change 通草 to 5 gram, added 炙甘草 5 gram, 超杜仲, 超白术 5 gram, and use another 3 days. This picture is just far after the patients take the tea the first time prescription for 5 days. After 5 days, we see the tongue change. The midline has back to the middle, and the white greasy tongue fur changed to white. And this absence shortage of the tongue fur has been covered by the white. So we know the inflamed lung has been recovered, and the most of heat dampness has gone, but instead of the body become a little cold damp. So that's why I modified her prescription. This is another case of the tongue diagnosis. These patients get leg edema, and this tongue picture is before it's the first visit. But actually, this also is a distance patients. The patients live in China, so she get let's see the senior patient, 90 years old, with unknown etiology of bilateral lower extremity edema, and he also had interstitial pneumonia and hypertension. He was hospitalized for the edema and used diuretics for about half a year, but the edema continued to recur. So after 6 months, her family think the patients cannot continue with the West medicine treatment because the patients can't walk. The patient coming into the hospital can walk. After half a year, he can only lie on the bed. So they send the picture to me, tongue picture to me. After I analyze this tongue picture, let's see. We can easily define this half is much bigger than the right half. The left half is much bigger than the right half. And the middle part get bulging, and the left part also covered with yellow greasy white fur. The right part just covered with the white greasy fur. And with this, we said the liver part has bulging, and the tips get flat. So according to this analysis, I made the herbal prescription for these patients. Is with I just simply to explain the prescription. We have Dangshen, Baizhu, for tonic the spleen. We have Fulingpi for the edema in the leg. We have Rugui to warming the kidney yang energy. Chaihu is for the liver qi stagnation. Chenpi, Houpu is mainly for the middle jaw bulging is caused, and with the Jinlijin for the middle jaw blockage, mainly for stomach. zhi huang qi is for qi deficiency tonic. Rou cong is for like work with Rou Gui together to warming the kidney yang, and also is good for the leg edema. Dongguaer is for the damp and heat dampness in the body. Taoer is for the blood stagnation, blood moving. Xing'er is for the qi descending for the lung. Shengmiya is mainly for stomach qi to grow up. Zhiqiao is for qi movement. Chuan for blood movement. Guqizi is for kidney energy tonic. Shengdi Huang is for the blood movement and for yin energy tonic. Zhigancao for tonic midojiao, and Da Huang is mainly for to eliminate the residue in their large intestine, in his large intestine. And after use this tea, the patients after use 6-bag tea, the patient's symptom get a big relief. Has get big relief. The edema was improved significantly, walking vigorously, and the tongue picture changed significantly. We see the tongue picture change, the tongue change. We see the midline head back to the normal. This is the first visit midline. So the midline deviate to the right side. And now, after 6-bag tea, the midline back to the central. And the bulging in the middle part has significantly changed, and the tongue froth from the yellow-white thick changed to white tongue froth. And of course, the liver part also getting flat. So we say, talk about this case. This is a hay fever case. This patient, a small patient, is 6 years old with hay fever and running clear nose, red eye, with company with yellow secretion, and with dry stool, constipated. We can see this tongue is red tongue. And so we see is the wind heat invade the upper jaw and made the lung qi deficiency. Made the lung qi lose their descending. Lung qi has accumulated in the upper jaw, and with the large intestine has heated up. So this is the prescription with 薄荷、连翘、淡竹叶、牛蒡子、辛夷、白术、菊花、桑叶、芦根、甘草、冬瓜子。Same dose each of the herbs give him 56 grams totally and 4 grams BID. After he finished the tea, the symptoms has improved significantly. Eye redness and swelling is resolved, and no yellow discharge anymore, and good bowel movement. So, but the upper part of the tongue is still white. So I added Rou Gui and remove Lu Gen, and also add Bai Bian Dou for the middle jaw. So after this, the patients, these small patients get well. This is a subacute thyroiditis. The patients, because has insomnia, the pain in the left anterior neck, and then she look for conventional medicine treatment, but get the painkiller, and the pain doesn't resolve. And also the patients has long-term depression, severe depression, and worse in the morning, accompanied with a various sense of fear, and a lot of acne on the face, irregular menstruations, unable to handle work and basic housework. So she introduced by her sister to my clinic, and I have seen, and when I took the tongue picture, I first found this red dot on her tongue thyroid reflection area. So I know her problem is from the thyroid. So I just made the judgment, the liver qi stagnation and the feeling of lung qi to descend. And then I give this prescription. And this case also you can find in this book. Okay, so after 2 weeks, the herbal tea, the patients come back and follow up with it. I took her tongue picture, and then you can see the red dot on the left thyroid reflection area has disappeared. And I know the patient's getting much better. Of course, the patient itself also told me her pain has finished and her depression also getting much better. After I have continued to give her the herbal treatment, after roughly 2 months, the patient has totally recovered, including the depression. And she hasn't went to work for 2 years. And she's a very famous, the T platform model. And then she back to work. All her colleagues is, surprised. This case is eczema patients. You can see her face is red, pain, itch with flake drop. The tongue is red with we call this line called 半香兰. And so I give the herbal treatment, and the judgment is alpha-diol heat stagnation, liver qi stagnation, and weak spleen energy, lower heart energy. This is a prescription. After the 1 week herbal tea treatment, is concentrated herbal tea. So we can see her skin getting much better. So the itch much reduced, the skin become very soft, and much less dryness. And so the running nose has stopped. So I just continue give another 2-week tea. And this case is I use the tongue to guide how to use acupuncture treatment, because half of my patients, I use acupuncture to treat them, and all of them guided by the tongue reading. These patients, we can easily to find the tips of the tongue is red, and the lower part of the tongue is white, and with the liver qi stagnated. So we see arpedial stagnation of heat in the upper part, called arpedial. Also, you can see cold and dampness in the lower part, or you can see lower jaw, stagnation of liver qi. So follow this tongue reading because the red on the tips. So we get the most tip point in our body is one is zhengcheng, this one. When you raise up your hand, you see this is the top one. It's a sign with the tip of the tongue. So this point should get a bleeding, puncture, zhengcheng, with blood, lead. And also use zhengwan guanyuan for the stomach, for the middle jaw and the lower jaw. Double taibei is for digestive. Left taicheng is mainly for liver qi stagnation. Yangfu is for the, we said is for the shaoyang dan, energy stagnation. And qimeng. Qimeng is mainly for the liver qi smooth. With this acupuncture treatment, one session, then the patients can get the same night. The patients get a very good sleep. It's not wake up at 2-3 o'clock, and after a few days, the symptoms start again. The insomnia symptoms start again. So the patients come back for the same treatment. After 2-3 treatment, the patients insomnia has totally recovered. This is just show the tongue change, and many times the patient's tongue change. Maybe you can't believe. Like this patient is from Bulgaria. I didn't see the patient. His doctor has sent his picture to me and the laboratory result. And this is alcoholic cirrhosis. And this patient has stopped work back home, just like waiting to die. And then his doctor sent the picture to me. I said, okay, I just gave the herbal tea treatment. After 1 month, his doctor sent the picture to me, and this laboratory result about his liver function. We can see the liver function get significantly changed, getting better. And the patient's back to work. If you don't see the teeth, maybe you think it's two different patients. If you see the teeth, you know this is the same patient. This is another patient with a brain tumor. From this picture, MRI picture, we can see a big tumor in the left back side and the right left back side. And after 2 years of treatment, herbal tea and acupuncture, so the brain tumor has gone. And this patient is from Germany, and his professor who in charge, her professor who in charge of her treatment told her, okay, I can't find your brain tumor now. So initially, and he suggested her go for operation, but the patients refused. Instead, they use Chinese medicine treatment. And after 2 years, the result is really good. And this is another treating patients get suppurative tinea pedis from the hand and feet. I didn't show the feet picture because it seems so ugly. And this is the tongue. After a month herbal tea, so the problem has cleared up. This is 3 books from me. This is English edition. You can find this on Amazon. Just print this name, Modern Tongue Diagnosis in Chinese Medicine. You will easily get it. Better to buy the second edition. And these two, this one is Principles and Atlas of Yin's MTD, and Yin's Modern Tongue Diagnosis based herbal methodology. Both books published in China in the People's Medical Publishing House, or People's Health Publishing House. I can't remember their English name. They are those book is has this book is really similar with this English one, but this book, the Chinese edition one, has appendix of the herbal tongue corresponding chart. And this book just made more details about the tongue diagnosis and the herbal corresponding, how they use in practicals, and a lot of case in this book. This book has a lot of my training the students doctor write it. They are not students anymore. They are, most of them are very senior doctor, and many of them are professor or PhD doctor. This book, you can read it even you don't understand the Chinese. Just use your Google Translator, use your phone, you can read it easily. And the same as this book. Yeah, but both this Chinese edition book, you need to buy from China. You can buy from Taobao. There's a training class in different countries and different content. This is an advanced class in hold 2023 in London. Yeah, online and face-to-face class and online. This is the 15th training class for modern tongue diagnostics. It's an online training course in Zoom, but this is in Chinese language. This is in New York College of Traditional Chinese Medicine. I just hold the lecture for this college about modern tongue diagnostics. Okay, thank you all. My report finished. If you are interested in my lecture, you can join this group in Facebook message or just join my WeChat. So we can continue to discuss this, or if you want to continue to study it,